Welcome back to our pregnancy strength circuit. Today we're going to be focusing on our core. And the good news is any exercise that we do thoughtfully with our breath is a core exercise. And while we're pregnant, we want to be strengthening our abdominal muscles because they're doing so much work to expand to support baby's growth. And I know there can be a lot of concerns about what we should be doing for our core, and especially as we get into our second trimester and beyond. And I'm here to tell you core work is important and supportive for your body as you're growing a human. So I hope you find this 10-minute circuit to be supportive for you and giving you some direct instruction on how to do it supportively for your body. So in today's session, you're going to want something that is about a 5-pound weight. I'm also going to be using something heavier that is a 15-pound weight later on in the class. I also have a resistance band, loop, and a ball. So have a few of these things handy to be able to participate in our exercises. Let's go ahead and start on the mat. We're going to come into a hands and knees position here. I'm going to start by inhaling to prepare, exhale to reach my arm and my opposite leg out in their respective directions. Inhale to bring everything back into center. Again, exhale, really think about those lower abdominals first, zipping up towards your rib cage as you extend your arm and opposite leg. Inhale to bring it back in. Keep moving in this way as I point out a few things. As we move our arm and leg, we want our spine to stay long. So ideally, we don't want to be arching at all or rounding. So be thoughtful that we're keeping that elongated position. Also check in that we're not leaning off to a side. We want to stay central, right where we are here when we start. And then really using our muscles and our core support to keep us center while we move our arm and leg. Now, if you're finding this really difficult to balance, option is to extend your leg and just keep it there, and then slowly control your arm out and in. And as that gets easier, then you can add the movement of the leg. Let's go ahead and switch sides. So from here, I'm gonna set up my table again. I'm gonna inhale to prepare, exhale to reach, inhale to come back in, exhale, inhale to return. And if this is feeling supportive for you, you can absolutely lift that leg off the ground depending on your strength and balance. So feel free to make that addition if you'd like. I'm gonna keep going here with my foot just tapping to the floor to keep that coordination. Good job, exhale. Keep that focus on your breath, leading with your breath, and really thinking about your two stationary limbs rooting into the floor to give you that support while you move the opposite pair. Last one here. Good work. From here, I'm going to trade my weight. I'm actually going to grab a yoga block. And with the yoga block here, this can also be a pillow or a towel roll, but I'm gonna place it here to work on some side and oblique work as well as inner thigh work. Now, our inner thigh and our oblique muscles are really important for support. They're important for rotation, but also for connecting across our abdominal muscles and supporting with the pelvic floor. So they're really important, especially through pregnancy, but also postpartum. So from here, I'm starting in what I call a 90-90 position with my legs. My elbow is directly underneath my shoulder. Now I'm gonna inhale to prepare. Exhale, think about that lower abdominal to upper abdominal connection as I press my top knee into the block to levitate my pelvis off the floor just a few inches. And then inhale to control my body back down to the mat. So again, I inhale to prepare, exhale to press, really feeling that inner thigh connection, feeling my obliques here all the way up to my lats into my armpit, and then inhale to lower back down. If this is a good enough challenge for you, stay here and keep going. If this feels pretty good, but you want a little bit spicier version, You can float this top knee up to get a little bit more core work, and then make it even spicier by floating that leg completely. Then you can float your body all the way back down, set that leg down, and repeat. So choose whichever level of spice feels helpful for you. So we're gonna press that top leg one more time. Exhale to lift. Inhale to set it back down. Let's go ahead and flip over to the other side. So a lot of people will feel pubic symphysis discomfort, and this is a really helpful exercise to work on that. Often our inner thighs need more strength to support up into the pelvic floor and around that pubic bone. So this is a really helpful exercise to prevent that, as well as to address it if you're having some discomfort. So again, to start, we're gonna press that top knee down into the block to levitate our body that little bit up off of the floor. If this version feels supportive for you, stay there. Then you're gonna inhale to lower back down. Exhale to float. Inhale to set it back down. Options to make it spicier include exhale to press up, and then you can float that top knee towards you. That will increase your oblique and inner thigh work, or you can go all the way up and then inhale to set it down. Exhale. To lift. Inhale to lower. Be thoughtful that your head, spine, and pelvis all stay in one line. We don't want our head jutting forward or our body twisting. We want to stay stacked. Last one. Inhale here, exhale. And return. Awesome. From here, I'm gonna swap my yoga block for a ball. We're gonna come back onto hands and knees, and my ball is gonna come between my legs. If you don't have a ball, you can use a towel roll or a pillow as well. You're gonna tuck your toes underneath, and we're gonna do a bear plank lift off. So we're gonna inhale to prepare. Exhale, we wanna maintain about a 50% squeeze on the ball. Lower abdominals are gonna lead as you exhale to float. Hold there for a full breath cycle. And then inhale to float it down. Once again, we reset. Deep breath in, exhale, float up. Anchor through both feet and both hands, keeping your spine long as you breathe. And then on your next inhale, you set it down. Keep going in this way as I point out a few things. As you exhale, really think about those two front hip bones drawing towards center and creating that zip upward. If we use our upper abs first to grip, then that's gonna pressure downward towards your pelvic floor and not allow your lower abdominals to join you. So really focus on the coordination of where that's starting first. Lower is where we want to begin and work up towards the rib cage. Another cue that can be really helpful is exhale and hug baby. Think about that hug from that lower portion all the way up. One last time here. Inhale to prepare, exhale to float. Hold there as you breathe. Inhale to set it back down. Next exercise, I'm gonna trade the ball for my medium heavy weight. So I'm gonna hold my weight off to the side. Feet are going to be a little bit wider than hip distance. And I'm going to side bend. I'm gonna allow that weight to glide down towards my knee. And then exhale to side bend a little bit the opposite way. So as I inhale and lower, I'm wanting to imagine like I have a wall in front of me and behind me, and I'm just gliding to the side. Exhale to return. So in pregnancy, as pregnancy continues, our rib cage starts to become harder and harder to move, both side to side as well as rotation, because baby's taking up all this space ahead of us. So we need to really train that motion of our rib cage and our obliques, hence why we're doing this. And also there's a lot of carrying in mom life where you're gonna be having something in one hand, carrying in another, and we need this opposite core challenge strength. So hence why we're practicing it now. One more here, side bending, exhale to bring it all the way back up. Switching to the other side, inhale to lower, exhale, inhale to lower, exhale. You may notice one side might feel a lot easier than the other. If that's true for you, that's helpful feedback to practice and do more reps over time on your harder side. That will also help even out your oblique strength, and also often helps a lot for people who have one-sided low back discomfort. This is a really common exercise that I prescribe for my patients who are suffering with that as well. So again, we inhale as we glide down, exhale to pull up. Make sure your shoulders aren't trying to shrug or do that work for you. Last one. Good work. Our final exercise here is going to be with our band. And I'm gonna recommend that you do the band in a figure 8 around your 2 arches. And if you feel like your balance is a little bit challenged right now, feel free to do this next to a wall or with a chair or a countertop for some balance. I'm gonna do it freestanding here, but please choose what feels helpful for you. So from here, we're gonna be working on our hip flexor and how that connects up into our abdominal muscles. So first, I'm gonna inhale to prepare, exhale, and I'm gonna march one knee up towards my chest. Inhale to slowly bring that leg down. We're gonna stay on the same side. So inhale to prepare, exhale to drive that knee up, holding there for a moment. Inhale to lower back down. Keep moving in this way as I point out a few things. As you exhale and drive that knee up towards your chest, really focus on planting through the tripod of your standing foot. Big toe, pinky toe to heel. We want our rib cage and pelvis stacked over that tripod so that we can really feel grounded and rooted, and that's gonna help our core to be able to connect even better. As you exhale and drive that foot up, we also wanna make sure that our rib cage doesn't lean back. That's a common pattern in order to get the leg up higher. Make sure that your rib cage stays stacked and really drive up as high as you can with your leg. One more here, exhale. Now let's go ahead and switch sides. So I'm gonna be standing on my right foot. Inhale to prepare, exhale. Again, think about that lower abdominal to upper abdominal connection. Inhale to lower it down. As you're here and you stand tall, that hip flexor is working with the lower abdominals and your opposite oblique. These are the muscles that are working across your abdomen to support baby, but also to support your entire body for movement. These are really helpful to keep training through pregnancy because our hip flexors are needing to do more and more work to support our body as baby is getting bigger. And this is also why we often have a lot of low back pain, because the hip flexors are getting too tight in the front, and that's creating more of a curvature in our low back. And if we don't have enough strength to support that, we get feedback from our body in the sense of pain. So strengthening our hip flexors also helps in this preventative way for being able to stay strong for the entire pregnancy. Good work, everybody. Last one, exhale. Working on my balance too. And then slowly return. With this hip flexor exercise, it's also really common for people to have one side that feels especially weaker than the other. If that's true for you, that's a really helpful opportunity to focus and do more reps on that weaker side so that you can help your strength of each side become more symmetrical, which will also help in keeping your pelvis more balanced, which is more supportive for your core and your pelvic floor. So I hope you found this core circuit to be a helpful challenge for you and also gave you some specific exercises that are pregnancy supportive for all the trimesters that you're in. And if you have any questions about core work or core strengthening throughout your pregnancy, please go ahead and drop those comments below so that I can help answer them for you. And I look forward to seeing you in our next strength video.